The newborn found comfort in her grandmother's arms, sheltered from the cold reality of her mother's death, just a few hours after she was born in Kongor, Tiati constituency. Her mother succumbed to the malaria epidemic that has swept across parts of the country, with Baringo and Marsabit counties hit hard. The Kenya Red Cross and the government scrambling to ensure help reaches the areas affected by the disease. This Beyond Zero ambulance now taking medication to those in need. 4 more people were confirmed dead in Kerio Valley, bringing the death toll in Baringo County to 24. Dozens others lined up for tests to ascertain whether they were suffering from malaria before receiving the much-needed treatment.
Of the people who are tested, 60% were testing positive, and then majority of them, unfortunately, are also children.
70% of residents who were screened in Marsabit tested positive for malaria. By Sunday, the Red Cross had screened and treated 1,000 people in Baringo and almost 300 others in Marsabit. Further efforts to provide treatment were, however, hampered by the rough terrain in these regions. In Marsabit, 27 more patients succumbed to malaria, bringing the countrywide death toll to 51. While the government has dispatched medication and 40,000 mosquito nets to Marsabit, logistical challenges mean the supplies are yet to reach hundreds of patients. While malaria is treatable, medics have attributed the crisis to a combination of factors, among them the malnutrition brought about by the drought that has swept through parts of the country and the difficulty patients are facing in accessing treatment.
We have been having fairly good rains from the month of July, which means that provides possibility of having stagnant water, be they in the dams and small wells. So that provides a good breeding ground for mosquitoes.
Katika hii location ya Lokisa hatuna hospitali yoyote ya serikali. Hospitali yenye tuko nayo tu ni private na ni kidogo tu, hata dawa yenye iko ndani hata haiwezi ikatoshea watu wote.
The Kenya National Union of Nurses Secretary General Seth Panyako expressed his willingness to hold further talks with the government in a bid to end the stalemate.
The resurgence of malaria and the outbreak of malaria is as a result of the breakdown of the primary health care system, which is 100% managed by the nurses. Dispensaries in this country are managed by nurses. But because dispensaries are closed, you expect such diseases which are managed at dispensary level like malaria and the rest to have a research. So we want to make it very clear that as a union, we are ready for dialogue any time of the day, because this is a very serious issue of national importance.
Hundreds of patients still waiting for help to reach them. Wilkis Anyabo, Sunday Live.